Hello, it's good to have you with us at this hour. I'm Daniel Che, here to bring you a live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. The session will be centered around updates on the coronavirus situation here in South Korea. Officials will fill us in on the number of new infection cases seen as of midnight and what kind of efforts the government is making to contain the virus, especially with the spur of cluster infection cases. Let's go straight to the scene to hear directly from the officials.
Let us now begin our regular briefing on the COVID-19 response here in South Korea for October 10th, Saturday. As of today midnight, we have 61 new local infections, and the total caseload now stands at 24,548. And additionally, 55 more people have been discharged, while 1,494 still remain in quarantine. We also have 89 patients in critically ill conditions, and we had 2 more fatalities as of yesterday, and I extend my deepest condolences to the deceased and the members of the bereaved families. Today, as of noon, we would like to give you some updates on the domestic infections here in South Korea. Please note that the numbers are subject to change. Starting from the Seoul City, in relation to the Singwang building in Gangnam-gu district, we have 3 additional cases, with the total now increasing to 8. And in relation to the Dobong-gu district Hana Hospital, we also have identified 7 additional patients so far, and we have confirmed 58 cases so far. And in Gyeonggi-do Province, Uijeongbu City, in relation to the Master Plus Hospital, we have 12 new patients being confirmed. A total of 49 have been confirmed to date. And in Busan Jinggu district, in relation to an acquaintance meeting, we also have 1 more additional patient being confirmed. A total of 14 have been confirmed to date. And in relation to an visiting infection shots meeting, and we also have additional cases. A total of 13 cases have been confirmed to date. And next, moving on to imported cases, we have 11 new imported cases. And as for the countries of origin, we have 2 from the UAE, 2 from Poland, and so forth. And as for the treatments, remdesivir has been also administered to about 585 patients across 62 hospitals here in South Korea. In relation to the live quarantine measures, we also have the Safety E-Report application, which is run by the Safety Ministry, and we have received major reports on the breaches of quarantine measures, including those at the venues like religious centers and door-to-door sales. And we have been receiving increasing number of such reports. And in the metropolitan area, we also have some reports about PC cafes where people also did not wear face masks properly, and also they had a smoking room in operation, and we have been seeing an increasing number of those related cases being reported. And the quarantine authorities here in South Korea would like to also note that we are seeing cluster infections spreading, especially through family meetings, and so we are asking you to keep a particular vigilance. And please also abide by quarantine measures when you are hiking to enjoy this great autumn weather. And during the weekend, we advise all of the religious facilities to switch to non-face-to-face means when you have your regular services, and please cancel and postpone group meals and small gatherings. And also postpone any of the small gatherings that are not essential. And as for the group hiking, please avoid going to the mountains in large attendance, and also please go with a minimum number of members. And when it is difficult to keep 2 meters of healthy distance, even at outdoors, please wear your face masks at all times. And if you find it difficult to breathe while hiking, please take off your mask and also keep a healthy distance with others and take some rest. And also, when you are enjoying meal together with others, please do not face each other, and also enjoy your own servings, and also minimize the level of dialogue. And last but not least, we would like to note that in Korea, COVID-19 infections, we are seeing ups and downs in the number of confirmed cases. However, we are seeing a gradual decline in the number of cases, and we are seeing stabilization to a large extent. However, we have some risk factors, including the fact that we have about 50 confirmed cases on a daily basis in the metropolitan area. And also, we have 3C conditions, including the confined, crowded, and close contact environments, during which we are seeing cluster infections being reported on going forward. And also, we are exerting our full efforts to monitor the situation, especially centering around door-to-door facilities, including those that have been breaking out in cities like Busan and in the capital area as well. And this means that if we stay complacent, we would have a large number of infections going forward. However, we are confident that we can overcome this outbreak with our energy and potential. And I tell you this because our public has a strong determination to overcome the virus, and they have exerted their full efforts to partake in social distancing measures. As far as we know, we believe that many people, regardless of the regular briefing and the media reports, they are also notifying themselves of the global outbreak conditions in many other continents as well as the domestic outbreak trends. And on top of this, many of our members of the public are exerting their full efforts to partake in the quarantine measures, including wearing a face mask and also abiding by strict hygiene measures. And against this backdrop, it is very important that we note that we are also evolving together with the COVID-19 virus. Going forward, we will see the COVID-19 virus being mutated going forward, and we will also note that the virus will also try to mutate so that it can live through all of these vaccines and also therapeutics that will be developed going forward. However, against such a development, our efforts to engage in R&D for the vaccines are also being speeding up. We earlier told you during a regular briefing that next year's Chuseok will be very different from this year. We will have a much advanced technology in terms of vaccine therapeutics as well as other areas as well. And we are also right now exerting our full efforts to achieve such progress. And we believe that a small progress and small advancement could bring about a great change in the future. For instance, a small technological development or a development in a new therapeutics could also bring about a great and significant change in our battle against the virus, including diagnosing the patients and testing of the patients as well. Because our battle against COVID-19 depends largely on our R&D measures, this is why even at this moment, many of our experts are exerting their full efforts on the field to carry out research and development. And we would like to note that we also call for your continued efforts. Thank you very much.
That's all from us at this hour. As always, thank you for watching.